Hi everyone, my name is Tristan. Welcome to the cpapstore.ca. Today we're going to be looking at the Inogen at-home oxygen concentrator. This is a continuous flow oxygen concentrator. I've shown a couple of different ones on this channel. Those are pulse, where this is continuous. The difference is with a pulse concentrator, it will shoot oxygen into your nostrils, usually depending on your breath rate. But a continuous concentrator will just have a steady flow of oxygen. Now you can see that this oxygen concentrator stands quite large. It's about, I would say, you can kind of see it's about 2 feet tall-ish, fairly heavy. This is not really a portable concentrator at all. It's called at home for a reason. It's meant to just stay on your floor, you connect your cannula, and then you use it throughout the house. Now this one in particular does not come with a cannula. I just have one here, but it does not come with a package. But sometimes you can get package deals with different accessories and stuff like that. So it depends where you're buying it from and who you're buying it from. But it does, of course, come with just the power cord and the machine here. So on the top of the machine here, we have this power button up top. Then we have some settings. It says 1, 2, 3, 4, 5, and a plus and minus. Now, unlike the portable concentrators, it doesn't have a screen. You'll see some of the other ones have a screen. This one's a lot simpler, just the plus and minus. So this barb here is just for your cannula tube. So you're gonna take the end of the tube and just push it slowly and gently, just like that. And there you go, it's nicely connected. So to put this on, you're just gonna put it underneath your nostrils like this, around your ears, and then you can tighten this up to wherever you feel the most comfortable. Okay, super simple. Okay, around the rest of the machine, we have just a carrying handle there. I like how it just goes nice and sleek with the top. You can carry it around. On the back here, we have a filter and this band where you can put your humidifier if you want to connect your cannula to a humidifier. And then on the side here, we have another filter. And then on the bottom, we have some little rubber feet there. We have this button. This button will just help take the bottom portion off so you can replace the columns. Now, I mentioned a couple filters, so I'm going to go through them one by one. So when you have the air intake into the machine, it's first going to go through this intake here. That's your particle filter. This particle filter you can take out and you should be washing at least once a week. So you just push it down and pull it out like that. And you're just going to use a little bit of mild detergent like Dawn or some little dish soap, not too much, and just put it on, rinse it off, and make sure it's nice and clean. And once it's dry, completely dry, then you put it back on your concentrator like so. Always put the particle filter before you turn it on. Okay, so that's the first filter. The second filter is the back inlet filter right here. So you can just pull it off straight up like this. And you can inspect the filter if it's looking a little bit degraded or dirty or what have you. Generally, this filter is gonna last between 3 to 5 years. Most patients replace it every 5 years. Or if you're changing patient to patient, you might wanna replace this filter. The last filter is your output filter. So that's right behind the barb. You'll need a special tool or a little spanner from Inogen, or you can probably find an off-brand one, but if you want to use the Inogen one, you grab it, it comes with the filters and you just spin it off, you take the barb off, then you can use some tweezers to take out that little filter. It's a little tiny circular filter, and with that filter, you're going to want to replace that once a year, or if you change patients with this machine. Now, when you set up this machine in your home, it's important to be mindful of where you put it. You want at least 6-inch clearance on either side of the machine, and just also be mindful of the exhaust. The exhaust comes out the bottom back of the machine, so just make sure there's at least 6 inches on the back of the machine so that the air isn't obstructed and can flow easily. And then of course your intake on this side, you don't want to obstruct that by any means. So the next thing I want to talk about is just the flow rates. Super easy, you just plug it in, press the power button, and then you can cycle between 1 and 5. Each number refers to the liters per minute. So a number 1 is going to be 1 liter per minute, 5 is going to be 5 liters per minute. And like I said before, that's going to be continuous flow. So on top here, other than the LEDs for the flow settings, you're going to notice 2 other lights, a blue one and a yellow one. These lights are going to flash depending on an alert that it wants to give you. So make sure that you consult your user manual if they are flashing yellow or blue. Blue generally means you're going to want to replace the columns, so the columns inside need replacement, but the yellow could be all sorts of alarms based on how they're flashing. So just make sure that you consult your user manual. And that's about it for the Inogen at-home concentrator. I hope this answered some of your questions on starting up with this concentrator. If you have any questions, feel free to contact us or visit our website at thecpapstore.ca.